Today I am going over Staphylococcus aureus. What is Staphylococcus aureus? It is a gram-positive, round-shaped bacteria that is gold in color and usually located on different areas of the human skin, such as the groin area, nose, and armpit. It is the leading cause of skin and soft tissue infections such as abscesses, boils, and cellulitis, which is red, swollen, really painful skin. S. aureus germs can also cause more serious infections such as bloodstream infections, pneumonia, endocarditis, which is a heart infection, meningitis, which is a brain infection, as well as bone and joint infections. Staphylococcus aureus is one of the 5 most common causes of infections after injury or surgery. Every year, 500,000 people suffer from it in American hospitals. So, some background information on Staphylococcus. It was discovered by a Scottish surgeon named Sir Alexander Ogston in 1880. He was performing a knee joint surgery on an abscess in which he was the first to describe Staphylococcus, and he described it as the masses looked like bunches of grapes, as you can see from the picture on the right. Now, the term aureus came from a German physician named Frederick Julius Rosenbach in 1884. He had a naming system which was to name bacteria based on their colors. So aureus, he got it from the word aureum, which means gold. He also gave Staphylococcus albus its name, albus meaning white. However, Staphylococcus albus was later renamed to Staphylococcus epidermidis due to its ubiquity on the skin. So, some characteristics of the bacteria. If you will break down its name, you'll find that you can decipher what it looks like. Staphyl means bunch, cocci means berry, and aureus means gold. If you'll see a picture of it, it will look like golden grapes. Now, Staphylococcus aureus is a facultative anaerobe, meaning it can produce ATP with or without oxygen. It is non-motile, non-spore-forming, and has a sodium chloride tolerance of 7.5%. You can identify S. aureus through the production of free coagulase as well as cell-bound coagulase. Coagulase is an enzyme that causes red blood cells to solidify as well as plasma. This causes clumping, or blood clots. It can also produce catalase. Also, one of its characteristics is being able to ferment mannitol. So if you're in lab and you want to identify S. aureus, it is best to use a mannitol agar. It allows staph to grow, and if bacteria ferment mannitol, it is Staph aureus, and the gel will turn yellow. So how can you be infected by S. aureus? It is spread by touching infected blood or body fluids, most often by contaminated hands. You can also inhale droplets from a cough and sneeze of an infected person. You can also come in contact with an infected person or infected object and contract the disease that way. A good way to prevent being infected by S. aureus is through proper hand hygiene, to disinfect affected areas, and to avoid sharing personal items like razors, towels, and needles. This is why in hospitals there is a strong emphasis on proper hand hygiene to prevent the spread of certain diseases. This was a picture I found from the CDC, and it states what puts people at risk for serious staph infection. This picture contains good information. So who is most likely to be infected? People with pre-existing conditions such as diabetes, cancer, vascular diseases are more likely to be infected. People who suffer from eczema can also be infected, as Staphylococcus aureus can enter the body through skin abrasions. A person admitted at the hospital through the ICU, as well as post-op patients, and patients with medical devices inserted in their body such as a catheter, would also be more likely to be infected. And lastly, people who often visit nursing homes and healthcare facilities are more likely to be infected. So what happens in the body with Staphylococcus aureus that causes skin abrasions? So staph can exist on the surface of the skin and can enter the body through damaged skin. This will trigger mast cells and macrophages to release inflammatory cytokines. This will cause an increased permeability of the blood vessels, as well as call immune cells to the infected area. So neutrophils will leave the blood vessel and go to the infected area to phagocytosis the bacteria. Once it eats up the bacteria, it will usually explode. This is how pus is made. Pus contains dead neutrophils, dead skin cells, and bacteria. Now, the reason why it stays in a localized area is because Staphylococcus aureus produces something called fibrin. This is for protection as well as containing the pus in a localized area. So what happens in the body when Staphylococcus aureus produces a toxin called toxic shock syndrome toxin? This toxin is a superantigen which has a high affinity for T cells. Due to its hyperaffinity for T cells, this will call a high concentration of T cells into an area to kill tissues. This is called a cytokine storm. Oftenly, this will damage tissue organs such as lungs, which will prevent a patient from breathing. This can be deadly. It also produces exfoliative toxins, which causes staphylococcal scalded skin syndrome. This affects infants and leads to loss of skin layers, dehydration, and secondary infections. It also produces DNase enzyme, which breaks down DNA. It also produces beta hemolytic bacteria. This results in complete hemolysis of red blood cells and blood agar. Another thing that is associated with Staphylococcus aureus is MRSA, which is methicillin-resistant as aureus. It is a much more dangerous strain than regular Staphylococcus aureus. MRSA comes from regular Staphylococcus aureus when there is a shape change of penicillin-binding protein. This becomes a lot harder to treat because it becomes resistant to a lot of the antibiotics that works with regular Staphylococcus aureus. However, MRSA can be treated with vancomycin. It does, however, come with a side effect called red man syndrome, which causes a rash on the skin, face, and other areas of the body. MRSA is very infectious, but as I said earlier, it can be treated by vancomycin. In conclusion, Staphylococcus aureus is a pathogenic bacteria that has a range of symptoms from mild discomforts to life-threatening conditions. It is spread by contact with an infected person or object, but can be prevented by proper hand hygiene. Some of the sources are listed here, and I suggest reading microbiologyinpictures.com Staphylococcus aureus, especially if you don't have access to lab. This website has pictures of Staphylococcus aureus in different media.